Hello, everyone, and I hope you are continuing to enjoy Science Week and the different things we have been looking at. In this video, what we are going to look at is how science can save lives. And in order to do that, I am joined by someone who knows that more than most. A couple of years ago, Pete Thorpe underwent a very complex operation that ultimately saved his life. So, hello, Pete.
Hello.
Can you just give us just quickly an idea roughly of what that operation and the procedure involved?
Yeah, the operation has quite a lengthy name. It's shortened to a PTE, which is I can't even remember what it's called. It's a very long name. What it involved is, because I had a number of thromboses, which are basically blood clots in my lungs, I had to have them removed, physically removed. They couldn't be dissolved by blood thinners. So what happened is I went into hospital. They opened my chest. They inserted various things into my blood vessels, stopped my blood flow, took the blood clots out, and then sewed me back up, in a nutshell.
Fair enough. That is the nutshell version of it. And when put like that, sounds, almost routine. And I'm guessing to the doctors that do that, it is routine. But we can't underestimate how serious it was, how the gravity of the situation, really. But I'm guessing also that you don't wake up one morning and think, I've got thrombosis on my lung. So I'm guessing that in order for you to actually have this looked at, you experienced some kind of symptoms. Just talk me through what they were.
I did, yeah, you're right. It did come on gradually. It was over a number of years. I had got blood clots. Well, previously, about 14 years before, I'd had a blood clot, and that was diagnosed. And they treated it with blood thinners. And after that treatment, I was able to live life as normal. Although they did say I would have to take blood thinners for life. I decided not to, because I played rugby and other contact sports, and I couldn't do that when I was on blood thinners. In 2016, however, I experienced a real shortness of breath, which got worse and worse and worse. And I went into hospital, and they found that I had more blood clots. They did an X-ray and a scan of my chest, and they did an X-ray and ultrasounds of my legs, because blood clots often originate from DVTs, or deep vein thrombosis, in the legs. But what happened was I had an accumulation of blood clots on my lungs again. So they immediately treated me with blood thinners and discharged me from hospital on the assumption that they would be dissolved and I would be cured. Over the next couple of years, so between October 2016, which is when I went into hospital, having suffered for quite some time, between 2016 and 2017, I then got worse and worse and worse, and started to feel really lethargic, very tired, couldn't walk more than a few hundred yards. I started to get blue legs. My lips were starting to go blue, and I was suffering from a lack of oxygen. So I went back to the hospital for more serious tests on my blood, on my heart, my lungs, my blood tests, my blood supply, and all sorts of things. Very complex range of tests I had through lots of interviews with surgeons and specialists in hospital.
I've known you for a number of years, and I remember seeing you at some of those times as well, when you were genuinely running out of breath every 5 or 6 steps at some point, needing to sit down. But I also know you as someone who likes to keep active. You've mentioned you come from a rugby background. I know you as an outdoorsy type person. And I know that one thing you've done to keep yourself going during various lockdowns is to keep yourself walking in, which obviously you're now able to do more than you did. Because you were so active, and you've mentioned the rugby, did the diagnosis that you received and the severity of it come as a shock to you?
It did. I recognised the symptoms from the previous time that I had a blood clot. So I knew something was wrong, but I was really reluctant to go to the doctors because two things. One was I knew they would do a blood test on me, which would prove that I had something, and I was in denial. And secondly, it was extremely painful to have that blood test, and I was afraid of the needle. So to be frank, I was quite scared of having a needle stuck into my artery and a blood gas sample taken, which is how they confirm that you've got a reduced oxygen level, which was a bit silly, really, because I'd have to have that done anyway, eventually, because that was how they would, first of all, diagnose blood gas levels being quite low. So I was just delaying the inevitable. And as I got worse and worse and couldn't, as you say, walk across the room more than 5 or 6 steps without going blue, I did a really silly thing. I went on a flight to Ireland for a Scrabble tournament. And when we got back, the first thing we had to do was go straight to hospital because I literally couldn't carry the bags. So yeah, it was my own fault. I delayed it. And then eventually when we were in hospital and they said, you have 20, and we stopped counting at 20 blood clots, then I knew it was serious.
And I mean, I know that the operation you're going to talk about soon enough happened at Papworth, but I remember visiting you, I think it was in Hammersmith, at hospital there. And if I remember rightly, while you were undergoing some tests there, you had some pretty scary experiences.
What they asked me to do was just a simple 2-minute walk test. And previous to this, at work, I would walk to the station in the morning, and it usually take me 5 minutes. But as I got towards being really, really ill, it would take 10 minutes, then 15 and 20. And at the other end, walking to work longer and longer. So it took me 45 minutes to get to work when it normally would have taken like 10 minutes of walking, with the train journey in the middle. And then one day we went out for a meal at work, and I couldn't carry my own bag to the restaurant, which was 2 minutes walk from the office. So when I went into Hammersmith for the tests, and they said do a 2-minute walk, I thought, oh, well, this will be easy. I'm not carrying a bag. So it was up and down a corridor. Do that 10 times. I managed 3.5, had to sit down, and they called a crash team because they thought I was having a heart attack. And they said, you are now not going home. You are staying. I was just in for day tests, and they said, right, we're admitting you straight away for serious tests. And at the end of those serious tests, I couldn't even ride a bike for a minute or walk for more than a minute. And they administered some serious drugs and then put me on a course of drugs which were designed to dilate my arteries and veins so my blood flowed a little bit more freely, which meant they had to keep me in hospital for over a week to titrate, which means to increase the dosage up to a serious level of these. And I was on the maximum dose permissible. And these drugs were amazingly, each tablet was tiny. Each tablet cost over £90. And I was on a course of these possibly for life. So the amount of expense that they were spending on me in tests and on the drugs, which were experimental, was quite incredible. But after that week, as you said, you visited, and you could see that after a week I was able to walk fairly normally, but I couldn't go uphill. I couldn't go upstairs. I still had to take the lift, and I couldn't really carry anything. Yeah, so it was very serious at that stage. Yeah.
And obviously, by the sounds of it as well, even though I did see that improvement, any sort of improvement at that stage, any sort of benefit was temporary. So prior to the operation. So moving to the main operation itself, what were you told about this procedure before it took place?
Well, when I went in for those tests and was put on those drugs, I was told that I was inoperable. In other words, the blood clots in my lungs, and they're not in my lungs, they're in the arteries within my lung space. They were unreachable physically. So I was told that I couldn't be operated on, I couldn't have the lung open heart surgery, and I couldn't have the clots removed. However, all of the information, the x-rays, the scans, and my diagnosis was sent to Papworth, to Mr. Jenkins, who is the top man in the country and who does these operations every day, or at least 5 times a week. Now, he took one look at the scans and said, well, I'm not going to get beaten by this. And he, after 6 months, was convinced that he could do the operation, that he could open me up, he could access however remote they were. And if you imagine your lungs are branches like this, there are 10 branches in each lungs of your arteries, and those arteries get smaller and smaller and smaller and smaller. What they were saying was that the clots were as far away from the biggest opening as possible. So they were way down into the smaller capillaries, if you like, and nobody could get to them. But he said, I can get to those. And I went to visit him in the hospital at Papworth, and he was convincing, and he said to me, I will definitely get 90% of those out, and I will be able to make you walk again and cure you. Just turn the light up because my screen just went off.
So he sounds like a man who, you know, was confident he could have success. And certainly if someone's operating in you in such a serious way, that's what you want. But I'm assuming this, well, we know this operation didn't come without its risks. What were you told about those, or what did you find out about those in advance of the procedure?
That's a good question. I went to visit him at Papworth, and the risks were explained to me by a reception nurse, a senior nurse who knew all about the operation and what the risks were and what the symptoms were. I was offered the opportunity, and I took it, to speak to a former patient, somebody who'd had the operation, so who could tell me what his life was like before the operation and after it. And they actually then showed us the operation on paper. So not a video as such, but what the operation involved, demonstrating where they would have to insert the apparatus, what they would have to do, and what the risks were. But they also said what the risks were of not having the operation. So, for example, in 2 to 6 years' time, my heart would be under such pressure and such strain that I was likely to have a heart attack and die quite young. And with the operation, there wouldn't be any heart pressure, and my heart would return to a normal size, and I would have a normal life. And he gave me the odds of 95 to 5, so 95% success rate, which was quite convincing.
It's convincing. I mean, I suppose at that point, when you're told that and when it's that stark, you know, I can hear that and think, well, it's a no-brainer, isn't it? You know, but at the same time, it's not me that's going through it. It's you, it's your body. And we know that you have been, you know, averse to seeking hospital treatment or medical treatment sometimes when you've needed it in the past. So what sort of feelings, emotions did you experience before the procedure took place?
I was quite wary. I didn't really want to have any such serious operation, but I did actually, coincidentally, I met a friend on the train who'd been to Papworth and showed me his scar, which is called a zip, because it looks very much like a zip going down the front of your chest. And he had triple heart bypass surgery at Papworth, and he told me his experience. And Mr. Jenkins explained to me as well that it is a serious operation. It's a 95% success rate, but that's overall. And at my age range, I was less than 60, well, 55-ish, 54 actually. The success rate was higher, but he could only quote the actual figures of 95%. He said they hadn't lost a patient there for over 2 years, and they'd done 50 operations a year. So the success rate was going up and up and up. So the odds of success were really high. Although, yeah, I was quite trepidatious. I went and sat in the car park, and I had a chat with Nikki, my partner, and we said, well, basically, what's stopping me, really? Because the odds are it's likely to be successful, and the counter side is I've got 2 to 6 years left. And we didn't know at the time, but my son was having a baby the following year, and of course, now I've got a granddaughter, which I can't see because of COVID, but that's a different issue altogether. I can still see her on Zoom. And now my daughter's pregnant and going to have a baby there as well. So I wouldn't have seen those things. And I considered that at the time. And before we left Papworth, we phoned them up from the car park and said, book us in and put me on the waiting list. So it was another 12 weeks of waiting when we were there to sort of mull it over as well. Now, any time I could have pulled out, obviously, but once I'd said yes, and I started researching at home and understanding what it would involve, how much time out it would take, I sort of pretty much resigned myself to having it done.
I actually remember being with Nikki, your partner, the day you were admitted, the day before you had the surgery. I saw her in the evening after she visited you, or she'd been with you to the hospital. And she talked me through bits of the operation and bits of the procedure. And I remember them saying that it was, a length. I mean, you've talked in basic terms about it at the beginning, but I remember you saying it's a lengthy procedure, a good, I think 9 hours was quoted as average when I looked it up the other day, just to remind myself. And so what actually happens, I know there's videos that we're going to put links to on this for the students, but what actually happens in those 9 hours?
Yeah, on that evening when you met Nikki, I was left in the hospital and they fed and watered me and said no more after 10 o'clock. Then in the morning, they came and gave me some pre-meds, which sort of made me a little bit relaxed. Gave me lots of drugs to take, which would help my blood thinning take place during the operation. And then basically got changed and went to the operating theatre. And in the operating theatre, obviously they would anaesthetize me, small needle in the back of my hand, put some drugs in, and because they'd fully briefed me, I didn't need to know what was going on the day other than they were going to do a 10-hour operation. And they told me that I was going to be in a coma for a day or so. I didn't really, after the operation, I can't remember how long I was in the coma for. You probably know more than I do. But the operation itself was, I think it was 10.5 hours in the end, because they went in to each side of the arteries coming out of my heart more than once. And each time they do it, it's 20 minutes of operation and 20 minutes of rest, and then 20 minutes of downtime preparing to going in again. And I think they went in to each side at least 3 times. So yeah, and that's a 6-hour job itself. But I think the procedure basically is to open you up, put some clamps on that keep your chest apart, start to cool your brain down wearing a cold cap, starting to liquefy your blood more than it is, i.e. Put some blood thinners in it, because they're going to drain all the blood out of the body, put it into holding tanks, and they don't want it clotting and blocking the machine up and so on. And then recirculating it through a cooling machine so that my body went down to 20 degrees as opposed to 36.4 or whatever it normally is, including my brain. And the cooler the brain is down to 20 degrees, the more chance of survival that the brain has without a blood supply and an oxygen supply. And then obviously cut my arteries open and start to forage along these 10 tubes on each side of the artery to take the blockages out. Of course, I knew nothing about any of that once I'd had the initial anaesthetist anesthetic. And yeah, I remember vaguely waking up thinking, what's this tube doing down my throat? A couple of days later.
Yeah, I remember you being out for a while, but that process of draining the blood from the body, I also remember them talking about the fact that they take it out for a while, then they've got to put it back in, haven't they? And then take it out. So they got, was it 20 minutes at a time in terms of?
20 minutes at a time to actually go in. And back your body as well. They take it, so your body's effectively got no blood in it whatsoever. They put you on what's called a heart-lung machine, which does your breathing for you and circulates the blood around your body whilst it's in you. Then they suck it all out, put it in a tub, keep it swished around like a slushy machine, I guess, and then put it back in cold so that your body gets a bit of oxygen, but it doesn't wake you up. And I don't think actually it circulated below my chest. So my abdomen and my legs and my arms didn't get any blood or oxygen for 8 to 10 hours, apart from a shot now and again, I think, just to keep them the volume up, I suppose. But then they'd suck it all out again and carry on. And they did that as often as they could until they think they'd got all the clots out.
The fact they can even do that now is just incredibly impressive. It's phenomenal. I mean, that said, given the way you've just described it, I now have students that won't look at a slush puppy in the same way again, based on the slush machine analogy. However, it is incredible that that is what they can do. And they were successful in removing a large number of clots. I know that, a significant number. I am going to warn people who are of a slightly squeamish disposition that they might want to look away briefly now, because you actually have photographic proof of what they took away from you.
I do. And
a snapshot t-shirt here.
I had it made into a t-shirt. This is a life-sized A4 print of what they took out. And if I put that up to my chest, that is where they took them from. So my heart is here, and the arteries go here and here, and that is a life-size representation. And the biggest clot there is the one on your left, is I think is 10.5 centimeters, but overall there are 38 pieces, 29 full clots, and some of them broke up. And the one on the right there is massive, and it's comparable to some of the biggest operations he's done.
Which is, I mean, when you see it like that, and when you see how many there are, and see that life size, that feat is just phenomenal. And the fact that they are not in you anymore is effectively what's saved your life. And I mean, I was going to ask you to talk about impacts that it's had on your health and your life. And you've talked about your grandchildren, one born and one on the way. And I mentioned that you being an outdoorsy person, and I know that you've been able to return to that as well. So I suppose what I want to ask is, talk to me about the recovery process from the operation, and, you know, knowing that things were better, but I suppose you talked about being in a coma for a while, and so I'm guessing you had to take it fairly slowly in that regard.
Yeah, well, when I woke up, I was, as I say, from a coma. I was bedridden, had a big scar down my chest called a zip, which is about 9 or 10 inches long, where they obviously opened my chest cavity. And I was in a lot of pain, and the bruises, I've got pictures of the operation and the aftermath as well. Quite happy to share them if anybody wants to see them. But I was sat in a bed and I literally couldn't move because of the lack of blood supply. My digestive system hadn't been working for 3 days, and that took over a week and a half to be able to eat and digest anything. I couldn't walk, and that took me another 5 or 6 days after I'd come round and started eating to be able to use my legs again, and they taught me how to walk again. I could use my arms, funnily enough, and I could move them around, but not very much because of the pain on my chest. And I essentially had to cuddle a rolled up pillow that they called my Bobby, and they put that on my chest, and I had to sit like this. And whenever I wanted to move, I had to utilize the core muscles in my stomach and my thighs. I couldn't do anything that would put any strain on it. I couldn't even make a cup of tea because I couldn't lift the cup up. I couldn't lift the kettle, anything like that, when I got home, obviously. So the recovery period in hospital was learning to eat again, learning to walk, learning to look after myself and do the everyday things. Then when I got home, I'd lost about 2 stone in weight, and most of that was muscle, and a little bit of chub. but my legs needed to be exercised. So I was doing squat exercises and using my legs to get out of a chair. Still couldn't pick anything up of any import and couldn't get dressed properly. So I had to wear cardigans and shirts that closed like this. So it did impact on my life a little bit. And I was at home, I think it was 11 weeks after the operation. And after those 11 weeks, I was basically able to work from home. But I could also travel back to the office carrying weights on my back in a backpack. Couldn't do anything with my arms still. And when I went back to the office, I was sort of looked after by all my colleagues. I didn't have to push anything around or move anything. And I couldn't really for about 6 months. And I think you remember, I couldn't even lift a table when we were moving them at a Scrabble tournament. So yeah, it did impact, but eventually it got better, and the muscles all knit together back on my chest, and I can do virtually anything now, except for the fact I've got a bad back, because I'm getting old and I've got other problems, which due to muscle loss and sort of skeletal deformations caused by playing rugby, funnily enough. I've now got a bad back, so I mustn't lift anything too heavy, but I can walk for miles and miles and miles. And as you say, I built up over, during the last summer, particularly during lockdown, when I was working at home, I could go out the door and be gone for 3 hours, permanently walking for 3 hours. And when I get back, I was not out of breath, which is incredible.
From where you were,
from where I was
2 and a bit years ago, that is just amazing. I mean, I remember seeing you a few weeks after it had happened, and I think 2 of the things I remember was, one, I think I took you out for one of your first trips out. You just came out in the car with me when we went to a shop, and there was a bump in a road, and you reacted very, very strongly to that bump. You know, that was incredible. I felt incredibly guilty that I hadn't missed this little bump in the road. But I remember you finding that incredibly painful. And the other one was when you coughed, and the pain you felt from that.
Cough, sneeze, or hiccup. Yeah. It was extremely painful. It was like having your chest ripped apart. A bit like I don't know if you've seen the scene in Alien, where the little monster comes out of his stomach. It felt like something was doing that every time. Yeah, I remember the first time we went out. Yeah, that was a bumpy ride.
It was a bumpy ride. I mean, I know you happen to live near some quite bumpy roads, but then again, it was nice as well to see that you were getting out and you were on that road to recovery. I think as I bring this to an end, obviously a lot of the people watching this, certainly some of them are considering science at university, potentially a career in medicine or indeed the medical profession. You came into contact with a range of people, and you've talked about some excellent nurses, and you've talked about the incredible Mr. Jenkins, who seems to be a very safe pair of hands. What sort of qualities would you say the ones you valued in the doctors and nurses who worked with you, the ones that you'd want people looking at this in the future to think about having when they're pursuing such a career?
Yeah, well, that's a good question. I think I was looked after by a range of people, from top-level surgeons, people who are highly skilled, through a range of nurses, daycare, critical care, and every single one of them had other people's welfare and well-being at the forefront of their mind. Didn't matter what they were. You know, the cleaners in the hospital, I nearly call it a hotel. The cleaners in the hospital were just as caring as were the surgeons. So first of all, if you're going into that sort of profession, looking after other people, caring profession, there's a range of levels of responsibility, but all of them had in common the fact that they were looking after other people and cared for other people. So that's the first thing. Obviously, Mr. Jenkins was a highly educated and very, very capable surgeon. But it's not to say that he couldn't have also been a good GP, which he was beforehand, and that he couldn't have specialised in anything to do with surgery. It's just so happened that he developed this process and was excellent at it. And he was teaching other people to do it as well at the same time. The critical thing that he told me that was his well, it came across in the interview with him, and also he told me, because I asked him what makes him confident, is that ability to decide. He said a good surgeon will assess properly, will look at the risk factors, would assess the success rate. Although because of their nature, they're willing to push the boundaries and take risks and do things that other people aren't. They're not willing to put people's lives at risk per se. And so in that interview I had with him, when he said, I'm 95% confident, these are the figures, this is how many people I've operated on, and this is the outcome. It was the level of confidence in his way of expressing it that persuaded me to say yes. So communication skills and expression and decision making, and that level of confidence, you need to be operating at that level. If you don't think you can do it, there's no point even trying. Basically, is what he said. And I know I can do it, and I will do it, and you will be fine. And that's what he said to me. So from him down to everybody I worked with across the ward, the sisters, the nurses, the catering staff, you know, they were all kind and caring. But his expertise and level of confidence just inspired me to say yes.
I think what sounds interesting is when you talk, I think I'm coming to a finish with this really, but when you talk about him always saying this 95% confidence, 95% success rate, if he'd have come back in and said, yes, 100% chance, absolutely fine, would you have been more wary perhaps than you were when he was talking about, you know, when he was giving you this 95 figure?
I would, because nothing's ever 100% successful. And the first thing he said is nothing's 100% successful. So if he changed his mind, yeah, or if somebody else had said, well, yeah, we can definitely do it 100%, no problem, then he said, you know, you can't listen to that. I'm going to be honest with you. And he was honest, and he was confident. So honesty, confidence, and an explanation of what was actually going to happen to me, rather than, you know, just sort of platitudes. He was actually honest and straightforward, and confident.
That's excellent. Pete, thank you so much for your time. Thank you for sharing with our students your experiences, not necessarily totally unique, but certainly a huge procedure that you went through, and for you with very, very positive outcomes and consequences. And hopefully that will be inspiring to some of our students who are looking at a future in medicine and the success you can achieve. And also to anyone here that's just looking at what science can do. This is a real example of what science can do. So I hope, students, that you enjoy the rest of Science Week. And Pete, thank you very much indeed.
Thank you very much, and avoid the red slush puppies.
Avoid the red slush puppies.